Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery
improve.
of Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Shaneca Smith. She's a certified registered nurse with over 17 years of experience in maternal and pediatric quality improvement experience, longtime advocate for fetal alcohol syndrome in Arkansas. Shaneca, thanks for being here today.
Thank you for having me, Robin.
So tell us what your work that you do with the Fetal Alcohol Syndrome organization is, and what does that mean for Arkansas?
Okay, so first of all, I'm just going to do a little bit of explaining of what fetal alcohol spectrum disorders is. It's actually an umbrella term that describes the range of effects that can occur in an individual who is exposed to alcohol during the 9-month period before birth. And so some of these effects include physical, mental, behavioral, even learning disabilities that have possible lifelong implications for the individual affected by it. And so the term FASD is not intended for use as a clinical diagnosis, but there are other diagnostic terms under the FASD umbrella as well. And so being a maternal and child nurse all this time, I have really fallen in love with the advocacy portion that is surrounding fetal alcohol spectrum disorders, and also with my current work at AFMC. I've been really tied to this initiative. And currently, I serve as the work group coordinator for Arkansas None for Nine, which is a nonprofit organization here in Arkansas that works to provide awareness of fetal alcohol spectrum disorders, or FASDs, within our state. And through this collaboration, we also provide support to individuals that are affected by FASDs and their families.
So tell us, what does that look like in a child or adult? Is it something that anyone would be able to recognize?
Well, some of the symptoms when it comes to FASD, first of all, they're all unique. It's unique per each person. But some of the common effects is that individual may have difficulty identifying dangerous people or situations. So it could be, the 17-year-old that's in a car with his friends that are getting ready to rob, a convenience store, but he lacks the ability to distinguish that this is wrong and I need to get out of this situation. And then he ends up in a situation where, he's an accessory to this crime. He's with them and, he's incarcerated. And, when you think about that in that term, then you have someone that is an adult that's incarcerated for a situation that they really did not understand that they were in. They can also be someone that models a behavior around them. It could be, a situation where someone may understand one day this is bad, but then the next day they lack the ability to get out of that situation. It could have literal, thinking issues or disabilities in regards to the thinking, difficulty with cause and effect, difficulty organizing, misunderstanding certain emotions, or having unexpected emotional and behavioral symptoms, the inability to make friends. They have the desire, but the difficulty to do so. And, also most notably in children, these characteristics of FASD are really similar to ADHD, but they don't respond with typical medications you would give someone that has ADHD. Another thing is that there can be physical symptoms of an individual living with FASD. We look at the philtrum, which is this portion in our lip. And so oftentimes when someone does have FASD, but I will say it's unique, they may have what's called, it's a smooth philtrum. Unlike someone that doesn't have, that characteristic. But it could be anyone. They may not have any facial effects at all. I will note that I spoke to a wonderful woman who is an adult living with FASD, and she shared that she wasn't diagnosed until she was 37 years old. So she went all of her life thinking that her symptoms were normal. She experienced issues with her brain, her heart, and her nervous system her entire life. And these symptoms were so evident in her day-to-day life, but no one knew what it was. And so she had to work harder doing most things than other people did. She had fatigue all the time and an abnormal heart rate. Her nervous system was affected. She needed, constant reassurance. She would also have a burning sensation in her torso, depending on what anxiety level she had. And she also noted that it takes her about 5 minutes more to explain things when she's communicating with someone or to get her point across. And it would have been very helpful if she had been diagnosed earlier in life and had those interventions in place.
So interesting. So it's really different, and there's not a cookie cutter diagnosis or set of symptoms or things that doctors can use to treat.
No, it's something that really takes a multidisciplinary approach. There's so many symptoms, and they're very unique to each individual. But with a multidisciplinary team of specialists that have researched this condition, they are able to identify it. The one thing about treatments is that there's no cure for FASDs. But our research does show, and the research that continues to be done, that early intervention treatment services can improve a child's development. And some of those interventions include therapy to help a child talk, walk, and interact with others. There can be medication management as well for certain symptoms such as depression or sleep problems or the inability to focus. Also, parents can receive education about their child's condition and how they can teach their child how to cope with their condition, and also empower them with skills.
And what resources are available? Parents, even healthcare providers. There are some out there.
Yes, there is an abundant amount of research, abundant amount of resources. For instance, the CDC has a website, cdc.gov/FASD, that is devoted to FASD. It provides helpful resources for providers, educators, families. Also links to organizations such as FASD United, which is the national voice on fetal alcohol spectrum disorders. This organization has over 30 years of experience in dealing in research, policies, practices, and living experience for individuals living with FASDs and also their families. Also, here, right in Little Rock, we house Arkansas's first Center for Diagnostics and Resources on neurodevelopmental disabilities, which includes fetal alcohol spectrum disorders, and they're phenomenal. They've often, and most recently and over the years, gotten referrals from other states as well that do not have such a center. And so the name of that center is the Specialty Diagnostic Resource Center, or SDRC. And that team is able to diagnose, treat, and also offer training on FASD and other neurodevelopmental disabilities as well.
That's wonderful to have something here in Arkansas.
Yes.
So with all of these resources, are people using them? Is there a stigma surrounding the illness?
Well, that's a great question, Robin. More and more people are becoming aware and utilizing the services. Our SDRC here stays really busy now, but you're absolutely right. There's so much stigma surrounding FASD. Women may be hesitant to discuss alcohol with their providers. And when this happens, it leads to incorrect diagnosis of a child. And we know that no woman wants to intentionally harm her baby. But, oftentimes society, will blame women that have drank alcohol during pregnancy for their child's disability. And this can also prevent women from speaking up about their alcohol use. And then we also have the stigma where people don't want their child to be stereotyped as different. And then when these children become adults, that same stereotype does follow them. And individuals can have perceptions that they're going to be substance users or criminals, and that's just not true. So, we have to recognize, that stigma is a big part of this, and also that alcohol is a legal and widely used substance. So there's even some hesitancy surrounding telling someone to stop consuming alcohol.
How does this affect the provider? Are you seeing issues with healthcare providers knowing how to treat it or how to move forward if they identify a disorder within a patient?
Well, first and foremost, if they don't get an accurate history of the mom's pregnancy, then this can lead to an incorrect diagnosis. And also, due to the stigma surrounding FASD, a doctor may be less likely to diagnose a child as having an FASD, or if they do, it may be like one of the last diagnoses on a child's chart and not something that's really, a primary diagnosis for that child. And then there's some hesitancy to tell women that they need to stop consuming alcohol. And, unfortunately, there are still some providers that authorize the use of maybe a little bit of wine during certain trimesters in pregnancy. But we know the research is clear that no amount of alcohol at any point in the pregnancy is safe.
So correctly diagnosing this is vital.
Yes, it's extremely vital because the proper supports for individuals living with FASD are what's needed so that they can thrive. They can live wonderful, fulfilling lives, but they have to be diagnosed early so that they can get those interventions in place. And then those early interventions also help to reduce the risk of secondary conditions that they can have along with FASD, such as the learning disabilities, mental illness, or even addiction.
So you mentioned the Diagnostic Resource Center that's here in Arkansas. Is that free? Can anyone use it?
Well, yes, anyone can use it. And currently there is a small fee for the appointment with the SDRC. And so what that does is it includes the interdisciplinary assessment, a full report, and specific accommodations for the child, in addition to access to training and resources for the child that are going to address their symptoms of their substance use. And also with an emphasis on the fetal alcohol spectrum disorder that they may encompass. But I want to note that we don't want any of this to hinder someone from going to be evaluated. The SDRC team, is willing to work with individuals or families that have a desire for evaluation. So if you're interested or know someone that needs to be evaluated, we, really advise everyone to go onto the SDRC website, which is arksdrc.org, to schedule an appointment or get more information, because they will not turn anyone away just because of the inability to pay.
And you mentioned earlier about the Arkansas None for Nine organization. AFMC has been a longtime supporter and have a connection. Tell us what that is.
Yes. So in 2018, Arkansas began its efforts to bring attention to FASDs. And so during this time, there was a task force formed that included several key stakeholders, which included AFMC, DHS, UAMS, and many other partners. And so they were tasked with developing a project for screening, diagnosing, and providing interventions for children that are on the FASD spectrum. However, the project ended in 2012, but the work wasn't done. So several agencies still came together as volunteers and formed Arkansas None for Nine. And so Arkansas None for Nine is a nonprofit that aligns with FASD United, which is the national organization for FASDs. And so AFMC has been a longtime supporter of Arkansas None for Nine, even from the inception of the task force down to today. AFMC continues to serve as, a part of the board as well as the work group, and they currently convene the work group as well. And I will note that in addition to working with Arkansas None for Nine, AFMC is also working with the SDRC to assist in spreading a training series that's been developed for practitioners. And so this training is going to be shared throughout the state of Arkansas to help practitioners be more educated about FASDs as well as diagnosing.
That was my next question. What do you want the provider community to know?
Well, we want them to know that accurate and early screening and diagnosing is vital. It's so important for them also to stay up to date on research surrounding FASD. There's numerous trainings available through the SDRC, and Arkansas None for Nine also offers training opportunities for providers, educators, families, support groups as well for families. So there's so many resources for doctors to stay up to date on the most important information. I will also note that Arkansas None for Nine hosts a biennial conference. And so, we always share that information, and AFMC is a wonderful partner and also shares that information with their provider network. And so coming to that conference, learning more information about FASDs is important. There's national conferences. September is actually Fetal Alcohol Spectrum Disorders Awareness Month. And then September 9th is Fetal Alcohol Spectrum Disorders Awareness Day. So maybe take a pledge to, on that day or even during the month of September at some point, learn more about FASD. Another important thing for providers is that they need to start educating women very early in their pregnancy. And I say even before they are pregnant, to avoid any alcohol consumption during pregnancy. We know that a most recent study showed us that approximately 1 in 15 first grade students throughout the United States are affected by an FASD, but less than 1% of those individuals are diagnosed correctly. That is, a sad but true fact, but we can change that. And it's through education and awareness. And providers also need to make sure that their patients are aware that if they are sexually active and they consume alcohol, they need to consider a form of highly effective contraception to avoid or delay pregnancy.
So eliminating the stigma is so important. Education early, so important.
Yes, extremely important. Without eliminating the stigma and creating that awareness and educating ourselves, we're not going to break the cycle of FASD, and we need to. FASD is 100% preventable. As long as a woman does not consume alcohol at any point in her pregnancy, the fetus is not at risk for developing an FASD. And so we have to break the cycle, raise awareness. And through this, it's also going to aid us in changing those social norms surrounding drinking during pregnancy.
Well, Shaneca, thank you for talking about your important work that you do with None for Nine and FASD across the state. We appreciate you being here today.
Thank you for having me.
And that's it for this episode of AFMC TV. Thanks for watching and have a great day.